Shortly after ordering the blood product to be released, it will arrive to the floor through the pneumatic tube system. This video will explain the specific steps that must be followed with all blood product transfusions to continue to ensure the safety of the patient. When blood products are received on the floor, there are some strict time frames that must be adhered to. Blood products must be hung within 15 to 30 minutes of reaching the floor. If after 15 minutes the blood is not hung or nearly hung, contact blood bank. They will most likely require the blood to be immediately returned to them so that they can return it to the freezer. Packed red blood cells must be completely infused within 4 hours. Any product that remains in the bag or tubing after that time must be disposed of. Blood tubing and primary tubing used in blood transfusions can only be used for 4 hours. This means that for most transfusions, each unit of blood will need new tubing. If units are being quickly infused, the same tubing could potentially be used for multiple units, as long as the product will be completed before the 4-hour window is closed. The blood will arrive to the floor through the pneumatic tube system. The unit must be verified, which means it will be rigorously checked to ensure that it is the correct unit of blood for this patient. This is accomplished with a process called double verification. It requires 2 RNs or an RN and a PCT to verbally compare patient and product information. This is covered in detail in another video of this series titled Blood Product Administration, Double Verification. After completing the double verification steps, begin the EPIC scanning process for your product. In EPIC, click on Begin Blood Transfusion. A prompt appears to link the product to a specific IV. Then scan the unit number, product code, and expiration date barcodes from the blood bag. If pre-vitals were charted within the last 30 minutes, they will auto-populate in the vitals field. If not, enter them here. Scroll down to verify that consent was signed, if any medications were ordered to be given prior to transfusion, and that education has been provided to the patient. 0.9 normal saline should be infusing. 0.9 normal saline is the only fluid that should ever be infusing with blood product administration. Now hang the blood. Close the roller clamp leading to the saline bag. Spike the blood product with the line with the red cap. Open the roller clamp below the blood product and prime some product into the filter chamber. Program the infusion pump using the drug library entry for blood products. This is the same selection that should be used regardless of the type of blood product being administered. Before starting the pump, the IV tubing must be primed with blood. Detach the tubing from the patient and cover the IV with a swab cap. The pump can be turned up to 999 milliliters an hour as long as it is not attached to the patient. This will quickly pump blood from the secondary line through the primary. When the fluid exiting the line is red, stop the pump and reattach to the patient. For the first 15 minutes of any transfusion, the blood product will be infused at a slow rate of 50 cc's per hour. Program the pump for 50 cc's per hour and input the volume to be infused, which could be different for every unit of blood product. The total volume in each bag can be found on the transfusion form. In this example, it shows 345 milliliters. During the first 15 minutes, the RN must remain in the room with the patient, observing for any signs of blood product reaction. A list of reactions can be found on the back of the blood product form. Use this as a reference. The front of the form gives a guideline for continued monitoring during the transfusion. This is not a part of the patient's record, and any vital signs written on this paper must be input into EPIC as well. It shows pre-transfusion vitals, which were completed before the product was released from blood bank. It then shows that vitals are required 15 minutes after the transfusion begins, 30 minutes after transfusion begins, and then 60 minutes, and every hour until complete. This can be confusing, but remember, it's time since the beginning of the transfusion, not time since the last set of vitals. So, if the transfusion began at 11 o'clock, the first set of vitals would be at 11:15, the second at 11:30, then 12 o'clock, then 1300, etc. If no reaction has occurred in the first 15 minutes, the infusion speed will be increased. For non-complicated patients, a unit of blood should be infused within 1.5 to 2 hours. Patients that have CHF or fluid overload need a decreased rate to protect them from further fluid overload. The maximum time for transfusion is 4 hours. When you are checking vitals, also listen to lung sounds. If sounds such as crackles develop, it is a sign that the patient is experiencing fluid overload, and the infusion should be slowed. When changing the rate, enter the total infusion time into the duration field. Policy does not dictate the specific rate for the infusion. It dictates the time the infusion will take. Some bags will have more or less than 345 milliliters of blood. They still need to be completed within the desired time frame, so entering a duration of 1.5 or 2 hours will allow the pump to calculate an appropriate rate for this unit of blood. While the blood product is infusing, be sure to regularly check on your patient and check vitals at appropriate intervals. When the bag is complete, you will need to follow a few more steps, covered in the next video of this series titled Completing Blood Products.